Do you have loose skin in your lower abdomen? Do you have a hanging fold? Have you lost weight or have had a pregnancy and post-pregnancy you have developed a lower abdominal skin fold? Then probably tummy tuck is the procedure for you. Tummy tuck, as the word suggests, is tucking the skin of your tummy to tighten and tauten it so that you can go back to your pre-pregnancy state of the abdomen or the skin. There are various types of tummy tucks. These are the types: mini, then there is a moderate, there is a limited moderate, there is a full tummy tuck, an extended tummy tuck. So these are grades of the tummy tuck. So it's extent of the skin that is removed that determines what it is called. So in a mini tummy tuck, who is the mini tummy tuck for? Mini tummy tuck is a procedure where we are taking out only the lower abdominal skin, just above your pubis. In that area, whatever you can pinch and approximate, that amount of skin is taken out, and your navel is not touched. Navel stays as it is. So it's only a lower abdominal or below the navel kind of an improvement is what you get. Above the navel, the skin stays as it is. So if you've got loose skin in the upper abdomen or you've got a bulge, then that is going to stay as it is if you only do a mini tummy tuck. Okay, and that may not look good. So you have to come for a consultation where surgeons like us would be able to determine which is the right procedure for you and guide you. So mini tummy tuck is not a procedure of somebody who has an upper abdominal loose lax skin. For them, they need a full tummy tuck. So what is done in a full tummy tuck? In a full tummy tuck, we release the navel. The skin from the navel is released. The navel stays where it is, but the skin is released. So we can pull the whole abdominal skin down, and we bring it down almost up to where the old navel was sitting in the skin. And all of that loose skin is removed. The navel is brought out from a new opening from where the navel is sitting. So it is brought in the same place, but in a new position. So that tautens your upper abdominal skin as well as the lower abdominal skin, and that is what is called as a full tummy tuck. So these are the differences. Do come for a consultation. We'll be happy to guide you. If you have any comments or you have any questions, do write in the comment section and I'll be happy to answer. Click like if you like this video, share it with your friends if they are interested in having a abdominal shape improvement, and if you wish to watch similar videos on aesthetic science, subscribe.